Hey everyone, welcome to the MedSpa Success Strategies podcast, where MedSpa and aesthetics practice owners come to discover strategies and tactics that help them better market and manage their practices so they can grow, scale, and have more financial freedom. This podcast is brought to you by my business, MedSpa Magic Marketing. I'm excited to be joined today by Mary Beth Hagen. She's the owner of Titan Aesthetic Recruiting. We're going to talk all things recruiting, staffing, and hiring. So thanks so much for joining us, Mary Beth.
My pleasure. Thanks for having me.
All right. So I guess first off, just tell me about your background, because I read your background and your bio on your website. You've been in the industry for a really long time, as we were just talking about. So tell us about your business now and kind of how you got to this point in your career.
Thank you. I am very, very blessed to have had the opportunity to work in aesthetics for just about 20 years now. I started back in 2005 with Medicis, which was the original distributor of Restylane, and then had the opportunity to go over to Allergan and manage a sales team over there for a couple of years before moving to the home office and taking on the BOTOX Cosmetic professional marketing role, and was lucky enough to launch the crow's feet indication and to work with really seeing the growth of the industry at such an impressive time back, kind of coming out of the recession, kind of thinking about where we went as those early 2011 to 2015 years. I then started the national account team for Allergan and worked with the large national med spa groups, as well as a lot of the big dermatology roll-up groups. And in 2017, I just kind of decided I was tired of living on an airplane. And my passion really lies with helping new injectors come into the business and giving them a good foundation and preparation and helping support aesthetic injectors in the industry. So I started Titan in 2017, and Titan stands for Top Injectors Treating in Aesthetics Now. And if we're talking about the training arm, you can change that T for treating to training. And what we really do is kind of provide kind of cradle to grave support services for non-physician aesthetic injectors, NPs, PAs, and RNs who are in practice and aesthetic practices across the United States.
That's awesome. So we kind of talked about my initial work in this industry, and it sounds like you kind of been in this industry since the late 2000s. Is that correct? What led you to those initial jobs, those initial roles?
Not that I ever thought I would end up in aesthetics. I had been in capital equipment and pharmaceutical sales for most of my career leading up to that. I had started out a journalism major in school and ended up in sales, and I really loved helping people meet their needs. And I literally fell backwards into aesthetics, like many of us in the early 2000s. I was working in the dermatology market with a pharmaceutical company, and one of my former directors had gone over to Medicis and approached me to come and chat with them. And when I first interviewed with Medicis, I didn't even know if I was interviewing for a sales job or a management job. I'd been a pharmaceutical manager for years before that. So when I started with Medicis, I was one of only 40 reps in the entire United States. Restylane had just been launched in the United States market in 2004. So I joined in 2005, and it was a really fun and crazy time. We were truly developing business at that point, and there was not much competition. I think all of us who worked for either Allergan or Medicis, Obagi, we all kind of supported each other and really helped build the industry as opposed to being competitive. So I've really seen the industry go from how do we convince people that Botox is not a poison and it's okay to look at these, and that, you don't have to be a famous movie star to have aesthetic treatments, to, now you look and we have a med spa on every street corner. So it really, having been there in the industry for so long and had so many great mentors within the industry, has led me to want to share those stories and to help the new injectors coming into the industry now really understand not only what they need to do to be good and safe providers in today's aesthetic world, but also understand some of that history and what a lot of the aesthetic providers had to do to literally create and credential the role of the aesthetic provider so that we could get the industry to where it is today.
Yeah, very interesting. So we talked a little bit too about just the the changes in the industry over the last, especially I'd say 12, 13 years, and how things have
Yeah.
grown, and how med spas seem to be popping up on every corner. And, now it's, the definition of a med spa is even kind of vague, because every practice, dermatologists, general physicians, plastic surgeons, everybody kind of dabbles in this market. So yeah, it's been very interesting to see the industry grow and expand. And I know that's posed a challenge for a lot of the people that are listening to this podcast, the spa owners that are dealing with, 4, 5, 6 competitors at times within a half a mile of their office. So just some interesting things when I was looking at your bio. You talked about when you were with, I think, Allergan, you worked to stop importers, practices that were doing imports, and to make sure that the products that were getting out to the market and into consumers were quality product. Can you talk a little bit more about that? Just 'cause I thought that was kind of an interesting little tidbit in your bio.
That is still one of they jokingly call me mama bear of the industry sometimes. And I feel very much that way, because when you look at product integrity, it is one of the most important things that we really need to preserve in the United States. There are so many products manufactured around the world. And people, here in the United States, everybody thinks that we have so many products now. We now have 5 neurotoxins, and we have more than 20 HA fillers. But in Europe, they have hundreds of products. In Asia, there are all kinds of products that are being developed. Big companies, small companies, they don't have the distribution that we have in terms of having smaller or fewer numbers of companies who kind of really dominate the market. What we found back in the early, 2010, 11, 12, 13, was that there were a lot of companies who were basically taking product that was intended for sales overseas or in other places, and they were either sending it to the United States and trying to sell it on the black market. Basically, instead of encouraging people to buy through the legal channels, through drug distributors or directly through Allergan or McKesson, they were encouraging people to buy this imported product. And many times we were able to help support the FDA and the Office of Criminal Investigation during my tenure with the BOTOX brand team to be able to help them shut down some of these illegal importation rings. And I literally have had situations from where we were able to work with FedEx and with the Office of Criminal Investigation to be able to shut down an international importation ring in Spain. We have worked to shut down an operation in Turkey that was buying Turkish product and basically rebranding it and putting new labels on it and selling it into the United States as U.S. product. We have shut down organizations where we had Russian mafia involved with call centers. And I was literally told, Mary Beth, they know your name, be careful.
Wow.
So yeah, we did a lot of work with the legal departments. We actually even worked with Groupon at one point because so many of the people who were buying this cheap illegal imported product were doing Groupon sales. And so we worked a legal parameter to be able to have Groupon have to have the Allergan representative be able to sign that they had an active Allergan account.
Well, that's interesting. So I don't think I realized that was necessarily going on, at least not to that extent. So these people, they were getting this product and basically marketing it and selling it as BOTOX or as another American brand. And it really wasn't. It was like a knockoff version.
There were 2 different things. Some of them were real Allergan BOTOX. You have to keep in mind that all the BOTOX in the world is made in Westport, Ireland. And it is then packaged and manufactured with the brand name and with the product labeling specific to the country or where it is being sold. There also are different laws. Like when you look at BOTOX in Europe, it is called Vistabel. And so they don't sell BOTOX in Europe for aesthetic uses. So some of these companies would go and buy the state subsidized BOTOX for therapeutic uses and basically relabel it and then try to sell it through these illegal channels in the United States. And I think a lot of times these sales teams for these organizations were very, very persuasive. Unfortunately, when the FDA would do investigations and they would shut down some of these, this was back in the days of faxes, and they literally would fax, buy this product, it's so cheap. And then the FDA would shut down the importer. And when they did, they would get the product lists and the company who had purchased that product, and they would then go and do raids. And there were several cases around the country where physicians who were buying and supporting these products were actually sentenced and in some cases even put in jail.
Yeah, that's interesting. So like this is a totally unrelated point to what I kind of wanted to bring you on for today, but I did want your
It's
thoughts
fine.
on
I
this.
can talk about 100 different things in aesthetics. I always joke.
Exactly. And this just led me to something else. You talked about people, basically these practices trying to find the cheapest way to get the product because then they can sell the product cheaper and use it as kind of a marketing tool. One of the things that I've just noticed recently, and I feel like it's just coming up a little bit more frequently, is practices that are really big, that are maybe franchises that have a long track record of purchasing from brands like Allergan. They're getting discounts on those products, and it makes it even easier for them to compete. What advice do you have for a practice that maybe doesn't have that competitive advantage of a low price point on those products?
You bring up an interesting thing that I think there are a lot of misperceptions about, because one of the things that's very important to understand, particularly with Allergan, and I'm not giving away any corporate secrets here. Confidentiality is very important to me and what I do with everything. But the government, even though BOTOX and BOTOX Cosmetic have different labels, the government looks at both of those products as the same price when they are calculating the average selling price. And that is only important when you think about the fact that everything is reimbursed therapeutically based on ASP, average selling price, plus 6%. So you really can't do a lot of discounting on the cosmetic side for Botox, because if you did a lot of deep discounts for Botox Cosmetic, it would affect the average selling price of Botox Therapeutic. And if that Botox Therapeutic average selling price gets too low, then ASP plus 6% would be a number that would be less than what they're buying it for when they buy it at list. So Allergan works very, 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 very hard to not do a lot of discounting on their cosmetic use of Botox. So for people who think, oh, there are these huge organizations and they get these drastic discounts, that's just not true. So, I want people to know that. I also, that's a misperception. I think that a lot of people who think I'm going to develop this big med spa chain and then, come into this market and I'm going to develop these really cheap pricing negotiations so that I can undercut everybody else. And that is just not an option in this market because of, these are still prescription pharmaceutical products that, are sold through drug distributors. And so there is quite a bit of scrutiny and work. Now, the fillers, there is quite a bit more price dynamic pricing there with that. But that is something where those discounts actually kick in at relatively small purchasing amounts. So you don't have to be a very big clinic to be able to start having discounts on a lot of the products from any of the manufacturers. So I really think it is, if someone is thinking, I'm going to come into this market and I'm going to have a large number of groups so that I can get a really cheap price and undercut everybody else, that is just simply not the way that someone is going to get a foothold in the market. The foothold in the market is always going to come from having great injectors, whether they are physicians or NPs or PAs or RNs, who are very, very good at being safe injectors that give great outcomes, that educate their patients well, and that give them an experience that really makes them feel like they get the result they asked for and that they're cared for during the medical process.
Yeah, that's obviously very true, and that brings up, I guess, the main purpose of the call. So real quick, the preface to this conversation, I guess, is what are you seeing in the job market right now in terms of, practices and the challenges they're having with retention or hiring injectors? What does that current landscape look like? The last 6 to 12 months.
Kind of been a crazy market literally since COVID. We've kind of had that perfect storm of a lot of injectors deciding that they wanted to open their own practices. It's very funny when I talk to private equity groups or investment groups that want to come into the market, they all focus on, I'm going to have beautiful practices and I'm going to have great marketing, and I'm going to have great branding, and I've got all this advertising and I bought all this beautiful equipment. And they save hiring the injector until the end, which is the absolute worst thing you could possibly do, because we are in a completely huge shortage of injectors here in the United States. And, what I think a lot of people don't realize is every other aspect of medicine, you pretty much can do a residency or some sort of academic training program to learn how to do your medical specialty. And aesthetics is probably the fastest growing aspect of medicine in the United States right now, but it has absolutely no academic training portal to be able to help anybody get a true certification in an academic setting. And in fact, the only certification we have in the United States right now for aesthetic injecting is the CANS exam, which is the Certified Aesthetic Nurse Specialist. So off topic a little bit, but what we're looking at in the market right now is we had this influx of people who really were thinking, you know what, I think I can create a med spa that I can offer a better customer experience or patient experience than what I'm seeing by having my services be offered in the existing medical practice. So you saw a lot of injectors leave to start their own practices right about fall of 2019. And then in 2020, obviously, we had COVID, which scared everybody in the industry, but which really also had a lot of people take those, 6 to 10 weeks off and think, what do I want to do? What do I want to be in my career? And so we saw a lot of people really focus on additional training. And there were so many webinars and training opportunities during that time that if I ever talk to a candidate and they tell me that they spent COVID doing anything except living on webinars, I say shame on them. So what we have now is a situation where demand has increased exponentially because of everybody looking in Zoom, and looking at themselves on video for, the last couple of years, and really then not being able to spend money on travel or buying a lot of new things because they had nowhere to go. And then you have all these injectors starting their own practices. And so all of a sudden we had a huge amount of demand, and every practice in America needed an injector. And so, but then there's no academic training to provide those injectors.
So you're basically left to poach. You're only poaching them from other practices. There's not like a fresh supply of new injectors, essentially.
Exactly. And so that's why at Titan, I've never been one of those who is comfortable doing a lot of, somebody told me the other day when I was telling them about Titan, he said, so you're not a headhunter. And I said, absolutely not. I will not steal somebody who's happy at one practice and encourage them to go to another one. And that's a lot of why most of what we do with Titan focuses on helping new injectors come into the industry with the right foundation and the right training. We're actually in the process of rebranding from Titan Aesthetic Recruiting to simply Titan Aesthetic. And really, we have had so much positive feedback and so much demand for the Titan Injector Preparation Program that we're really looking to focus on bringing new injectors into the market and then placing them with that strong foundation. Because what you find with existing injectors is they either already have 10 places lined up that they could go inject if they are not happy with where they are, or they go to start their own practice, or if they leave and they go to another practice, often we'll see them, they're not looking to go into a practice to support the brand of that practice. And honestly, when a practice is looking for an experienced injector, they're not saying, I want an experienced injector that nobody's ever heard of. They want that injector with their brand to bring their patients to that practice. Yeah. And, that leads into a whole host of other things. So what we've really focused on is helping to prepare injectors the right way with the right foundation of knowing the industry, understanding facial anatomy, and knowing the why behind injecting, and also understanding things like the history of aesthetics, understanding compensation, understanding that the job is not just standing in a room and injecting neurotoxins, but it involves education and marketing and patient awareness. And, really growing a patient base is as much a part of the job as being an injector as injecting is. And I think a lot of people need to understand that.
From a marketing perspective too, like we always talk about, once someone's in your office, big component of a successful med spa or successful practice is going to be keep people coming back for more. You don't want people that are coming in for, a cheap round of Botox and then never coming in again. And a lot of that relies on the experience with the injector.
Exactly.
And that's that level of comfort that you want to go back to when you feel like somebody did a good job. They understand what it is that you're going for in terms of a specific look or the application of the product. So Yeah, I mean, that's obviously a crucial component to the success of any spa, having a top injector. And I guess, so what defines, you use that language, top injector, I know on the website, what defines a top injector?
Well, I think the top injectors are those who have a high awareness of the clinical use of the products that they're using, that knows their anatomy and how to inject in as safe a manner as possible. There's always going to be adverse events with every single injector. So it's not a matter of, you know, oh, I hope I never have one. It's a matter of knowing what to do when something happens. It is a matter of being a good mentor to others. It is a matter of being someone who is a positive role model in the industry, both with patients and sharing information about the industry and the products and the treatments, as well as being someone who is open to answering questions for prospective and new injectors. I speak a lot at a lot of the different conferences, and I'm getting ready to travel to Boston for iSpan. And I'm actually moderating a panel on digital strategy within the aesthetic market. And we usually do kind of what we call an OG panel. So the originals from the industry. And we have 4 wonderful injectors who have been injecting since before 2000 or early 2000s. And it's fun to talk with them about what it was like back when they first started, because I know, the younger injectors and business owners can't even fathom this. But, when I started in this industry, we barely had cell phones. We didn't have, I remember setting up one of my favorite injectors. I set up her first email address for her when I was the Restylane rep. And so we literally, all of this has started within the last 15 to 20 years in terms of how do you market and how do you let somebody else know about your services. So that old word of mouth referral was really very important for those injectors. And I think you see in this market now that the top injectors are still the ones who don't do a lot of marketing and advertising, who aren't spending their life on Instagram or TikTok. They are the ones that their books are full of happy patients telling other potential patients about their services and about the success and the outcomes they've had. So that's a top injector. They do a good job and they give back.
Yeah, absolutely. So I guess also like you just mentioned, if you're a rock star injector, there's always another practice trying to poach you away. And as a practice owner, like what kind of tips or recommendations do you have for them in terms of just employee retention for their good injectors that really are such a crucial component to their business?
Thanks, Ricky. That's such a great question, because I actually have talked a lot about this at AmSpa and Aesthetic Next and Aesthetic Extender Symposium the last couple of years. And we really have to think about 3 things in terms of retention. It starts with, what are the expectations that you set when you hire someone? Do they understand what the opportunity is for them staying within your practice? The second thing is looking at how do you support them from an education standpoint? I am really a big fan of doing away with non-competes for experienced injectors. And first of all, they won't sign them. But secondly, you want someone to come to your practice as an experienced injector and bring their knowledge and their skills with them. So why would you then ask them to sign a non-compete? Because if they left somebody else to come to you, you got to, pot can't call the kettle black or whatever. So what I really look at is we need to start looking at these injectors as practice partners, or truly as people who there's still people who look at injectors as just employees. And what any med spa owner will tell you, if they've had a great injector and that injector is left, much of the business is your injector. And so I encourage my clients to do a couple of things to keep retention strong. I encourage them to always provide additional learning and education resources, whether it be a CME stipend, whether it be sending them to conferences, whether it be bringing in ongoing training. I think that's something that's absolutely important. There are great cadaver courses out there now. There are great international courses that people can attend that are wonderful thank yous that a practice can show how much they appreciate their injector by investing back in them. The second thing is, I am a huge believer in tenure bonuses. So when you have an injector who has been with you for quite a while and they have a good bit of tenure, give them a reward for staying with you. I look at people and I say, why would you have them sign a non-compete that is basically setting up an adversarial relationship from day one, when you could say, you know what, as a new injector, come to us. We're going to ask you to pay for your own foundational training because we want you to invest in yourself so that we feel comfortable investing in you and your training and helping you come into this industry. But when you've been here for a year, we're going to give you a bonus back in the number of dollars that you spent in training yourself that first year. So it's investing back in that employee. The other thing that I look at is there are a lot of places where giving them profit sharing or even equity in the practice is an option, because if you have someone who is vital to your business, you need them to stay. And so why not give them that opportunity to, if they would like, have some ownership in the practice. And because if they're the ones who are bringing the revenue in, if they're the ones who are building the business with their skills and talents, you need to recognize that as a business owner. I'm even seeing a lot of physicians now, especially plastic surgeons, who are getting to the point where they're not 100% sure they still want to keep up the surgical schedule, but they have built a great non-surgical side of the practice. And so they're in some cases literally looking at having their injectors become partners in the non-surgical side of the practice so that they can transition as they get older and reward that injector who's been with them for quite a while.
It's very obvious that those injectors are absolutely critical to the business, like you said. And I hope like spa owners that are listening to this don't overlook that and think that I think the brand loyalty that your patients have is less to your spa and it's much more aligned with the injector. So you obviously talked about those financial incentives, and that's going to be a big component to keeping your good employees around. Is there anything that you would add to that, like in addition to those financial incentives, like in terms of like flexibility of hours? You mentioned profit sharing. Anything else maybe that's not revenue based specifically, or not pay based, that you can do to help retain your injectors and your good staff?
Absolutely. One of the things that we do at Titan every year is the Titan Injector Compensation Survey. And we ask people how they get paid and what they get paid and how much revenue that they bring in. But we also ask them what they value in terms of staying with an employer, or what are the things that they would have wanted to have had to stay with an employer if they had left. And every single year, the number one thing that injectors ask for is better work-life balance or scheduling flexibility. And I think that's something that really surprises a lot of practice owners, because really injectors are, you wouldn't tell your physician, who's vital to the practice, we're going to tell you when you have to work and when you have to be here and when, you can take time off or can't. They just do it. And, when you've got a very experienced tenured injector, it's great to give them that same flexibility. And trust me, the experienced injector that's been around, they're going to figure out the time that they need to be there to get those patients in, because that's their lifeblood and they want to care for those patients. The other thing we see is really providing ongoing promotional. And when I say promotional opportunities, it's not so much of you're getting a promotion, but growth opportunities within a practice. There are a lot of senior and experienced injectors that I have spoken with in the last couple of months that have told me, I still love injecting. I love seeing my patients, but I kind of want to transition to do some other things. We all seek growth in our careers, and so many people who are coming into the med spa industry are doing because from other industries or from other jobs, or because they want to change their life. And you need to understand that your injectors also want to continue to grow. And so giving them opportunity to learn angles of the business, giving them opportunities to learn different ways of bringing new services and being in charge of new products and treatment selection is something that you can give them responsibility for, that will help them grow and help keep them satisfied from a job perspective.
Yeah, that is awesome advice. I'm sure like a lot of people are going to love that. I think that was a super clear blueprint to and I think that's something that I think a lot of people probably just overlook that, because you were, like you said, thinking of your injectors as a crucial component to the business and almost at least treating them more like a partner than an employee probably puts you in a position where you're going to be more successful with the retention out of the gate, and then giving them those financial incentives that are tied to, would you recommend like tying those to growth of the spa? So like, let's say you're a med spa that's doing 1.5 million a year, and you're able to get to $3 million a year? Do you kind of tie that directly to the growth? Like, how do you, I guess, set the expectation for the injector of when those things are going to happen and how that kind of plays out?
Ben Hernandez with Skytail Group would laugh at me right now because this is something that I have about 100 different ideas for. Um, One of the things that I have found is it really doesn't make a difference how you do it as long as you do it. So when you're looking at involving, whether it's just your injector or even your entire team, you can give them profit sharing. You can do equity. You can do phantom equity, which is kind of a profit sharing type of thing. And I am not a financial expert with any of this. So please understand this is why I refer all of this to Ben.
I recently just read about the phantom equity, so I'm just newly familiar. So yeah.
Yeah. And it's basically, you want to look at giving people opportunities that will meet their needs. So where that comes back to is talking to your employees. And actually, at the next AmSpa meeting, I'm going to be speaking on performance evaluations for your injectors, because one of the things I've learned as we've done so much compensation consulting over the last couple of years is that as an injector gets in a practice and brings in more and more revenue, the physicians who own the practice oftentimes get scared to death to have a performance review or any sort of conversation with that injector because they're like, oh my gosh, this is amazing revenue. I don't want to rock the boat.
Yeah.
And it's exactly the opposite. Your injectors, and I think it's one of the things that it would be great for practice owners to really understand is your injectors, for the most part, are going to be nurses, nurse practitioners, and PAs. And if you really understand why they chose that profession to begin with, you understand a little bit more about their psyche and what drives them as a human being. And we do something at Titan called the Titan Aesthetic Screening. And we oftentimes work with employers before they hire an injector or other staff member. And we do a 1 hour screening over the phone. And it's not like all the other screenings you've heard about. It literally is an aesthetic specific proprietary screening that I developed. And we talk to them about who are they? What are their career goals? What motivates them? What are they looking for in terms of how they want to work with their coworkers? How do they want to work with their managers? And when you understand what drives somebody, it can really make a difference in terms of setting those goals for them. And many of your nurses and nurse practitioners will tell you that they got to do this for two things. Number one, they want to care for others. And number two, they want to be appreciated and valued for that work that they do. So if you have a great aesthetic injector and you never talk to him or her and you never give them feedback and you never include them in the celebration of how well the business has done, you leave them with a feeling of wanting more. And that's where they may leave elsewhere. I have a injector that I've worked with for several years that called me one day and said, I'm so excited. I just hit this amazing number in terms of revenue for the year. And she was so excited to have her performance review. And she said she sat down in the review and the practice manager didn't even know how much revenue she had produced that year.
Oh, wow.
And trust me, it's a number that everybody listening out there would love to have this injector. So I'm not giving any more.
So that's your process on your site is screen, train, and grow, which I want to get back to in a second here. But there's one other thing that kind of came to mind there. So we're talking about rewarding your top injectors. So I guess two parts of that question. One is, how do you differentiate who your top injectors are and the people that are really a crucial component to the ongoing success of your business long term to someone who's maybe just kind of doing the job? Like as a practice owner, if you're trying to audit that and figure out who's really the top performer and who's maybe just kind of just getting by and they're satisfactory, but they're not necessarily someone that's critical to the business. Is it just numbers? Is it the people that are coming back where like their patient retention?
I'm laughing going, there's so many different ways you can answer this as well, Ricky, because most of the time it's going to be all of those things. I mean, I don't think any manager has ever sat down and said, I can't tell you who my top employees are.
Yeah.
You know, because they are the people who are committed to the overall goal of the business. They are the people who are bringing in revenue with their services. They are the people who have retained the patients who come back into their practice. They are the people who are constantly looking for what else can I do and how else can I contribute? And they're the people who are the team advocates for the practice. But a lot of that starts with the practice ownership. And if you are a physician or if you are a practice owner or manager and you're not setting those mission goals and you're not setting that culture and you're not creating that environment for that to be supported by your team, then you've got to take a look in the mirror as opposed to looking at your injector or any other employees. And yeah, that's a lot of what we're going to look at with this doing performance evaluations for injectors, because a lot of it is setting those goals and setting, what are the objectives that you have for the practice if you own it, and how are you communicating that? Because they can't just read your mind or get this by osmosis. So you've got to be a good communicator.
Yeah, so even though, like, if you're a spa owner, like you said, you kind of know who those people are without really having to crunch the numbers, but it's probably good, like you said, to have that attached to some sort of metric so that you can reward based on something. And I guess in terms of potential jealousy and kind of like, I don't know if jealousy is the right word, but creating a sort of rift between your injectors. If you have someone that's a top injector that's getting rewarded to a certain extent for performance and somebody who's maybe not, is that ever a challenge? Are you trying to, like, are those people all kind of in a rising ship simultaneously, or are you rewarding those people individually, and any challenges there?
I know this is going to be different. I mean, there are going to be people listening to this who are going to say, oh yeah, I have that. And others are going to say, what are you talking about? Because it's all based on human personality. And there's always going to be that one person who is, that may be in a practice that's a queen bee, and that I want all of the fame. I want all of the notoriety. I want all of the awareness. I don't know if I would, it depends on what you want in your practice. If you've got one person and they're doing that and, they're meeting the goals that you set as a business owner, that could be fine. And maybe that person then is more important to you and your practice than everybody else. It would not be what I would look for in a team. But, that's one of those things that a lot of people in the aesthetic industry are now having a lot of discussions about the role of social media. And, what is that doing not only to new injectors coming into the market and looking at, oh my gosh, do I have to post every day? Do I have to, have Prada bags and Louis Vuitton shoes? And, do I have to spend $10,000 on clothes before I go to an aesthetic meeting? Do I have to, and, that's not, it's fine if people want to choose to fulfill their success that way, but it should not be thought of as the standard in the industry. The standard in the industry should always be looked at as, are you a good clinician? Do you provide good and safe outcomes? And are you a good mentor for patients and for prospective, your teammates, your other, colleagues that you work with?
Yeah.
And maybe I'm old fashioned and old school, but I still believe I would rather have that person who is, a middle of the road producer who is a great team player and a great teacher and a great coach and a great person than to have the one superstar producer who is toxic.
Yeah, absolutely. You want to talk any more about that? Just the whole fact that, like, the social media world when it comes to just injectors and med spas in general. And you touched on that a little bit, but I know we talked a little bit about it before we jumped on here for the interview too.
It's so interesting when you talk to, we talk about those top injectors, some of the injectors who have been around for, 20 years or so, they will all tell you that they really have a moral issue with a lot of what they're seeing on social media these days. And I don't think Facebook was so bad because you can post information, you can post links, you can post more still shots. When the reels and the stories and things like that started coming, where it started creating this pressure of, what do you look like? What are you doing? Where are you going? I think that can, and I don't want to use absolutes, but it can hurt the industry in two ways. It can really be a off-putting for new injectors coming to the industry to think,
this is what I have to do.
Yeah. Is this what I have? Do I have to, like when did fame and entertainment become part of aesthetic medicine?
Yeah.
I think that's the big question we have. But the other question is, we started in this industry with people thinking that, aesthetic procedures were for the rich and the famous and, celebrities. And we've really spent 20 years of making information available to everybody so that, whether you are somebody who wants to get it one time for a reunion, or somebody that you're like, you know what, I just like spending money to help me like what I see when I look in the mirror. We've made it about as normal as coloring your hair. And I get a little bit nervous when we have so much of this social media parade, I guess, that we're going to start making patients stop thinking, oh, I have to have those clothes and those shoes and that hair and, in order to get these products. It's not.
That's actually really interesting. I never thought about that, but that's really interesting. It's almost like the glamorized version of everything.
Yeah.
It might be counterproductive in terms of like appealing to patients, because if they don't connect the dots and see themselves in that same vein, then they're gonna be like, well, that's not for me.
Right. Well, and it's really interesting because when I first started Titan, I had several physicians who would say, I need somebody who looks on brand. And it was so interesting to me and I said, so what they look like is more important than their injection skills or their medical skills. And, of course they're like, no, those things are really important, but I need them to look this way as well. And, I said, well, let me ask you a question. Unless you're in Orange County, California, what do most of your patients look like? I mean, I'm not anything other than girl next door. I'm never going to be, tall and thin and, long flowing blonde hair, but I'm a lot of what most of the, aesthetic patients look like out there. And if we have injectors who are filtered and, present an unattainable vision, I think we do run the possibility that we're going to basically exclude potential patients from coming in because they don't feel like they fit the brand.
That is an awesome takeaway. I love that. That's really good to think about as a practice owner, to be like, instead of always having to think of, you need to hire this person that has this certain look, it might actually be a turn off to patients. And like you said, it might be better to find someone that looks like an attractive version of what people around the area look like, and make it less intimidating for people to go in. Like, I don't think people want to sit in a chair with an injector that they think this is a disconnect from what I'm going for either.
I found two things. I've been in this industry for so long, and I've had patients share such lovely stories with me. When I was a Restylane rep early on, I had the cutest, probably, I say this cute little 60-something-year-old, and I am going to be 60 next week. So I guess our visions of how old things are changed through life. But she looked at me and she said, well, honey, you're new at this, aren't you? And I said, well, yes, I am. She said, well, let me tell you why I love these products so much. I love them because they make me look like my memory of myself. And Ricky, it was the most beautiful way to describe these things, because when you talk to anybody who gets aesthetic procedures, I will bet you that almost every single one of them will tell you they don't do these for somebody else. They do these aesthetic procedures because they want to like what they see in the mirror.
Yep.
And when I was BOTOX product manager, one of our campaigns that we looked at running was literally a woman looking in the mirror and saying, all I see is me. They don't want to see the lines. They don't want to see the age spots. They don't want to see things that remind them, that we're aging. They just want to see, here's what I remember myself looking like. And that's the beauty of this industry.
Absolutely. That's awesome. All right. So I just getting back to your methodology here of the screen, train, and grow. Do you want to just touch on that? I think we talked about the first two, that last step of a good injector, that path of growth. What does that look like?
We've laughed this week because we literally are kind of in the process of kind of updating that. Our mission statement with Titan is that we support great injectors and great practices for great patient outcomes. And I apologize, Tugger really does agree with that as well.
I've got a baby crying downstairs on and off, and thunderstorms going on outside. And hopefully our little software here does a pretty good job of like blending out the background noise anyway. So we're all good.
He may end up in my lap, so everybody may get to see what Tugger looks like here in a minute. So awesome. He's a very cute little guy, but he sometimes can be very loud. So anyway, so there. Everybody say hi, Tugger. So what we look at we've kind of adapted our 1, 2, 3 process. It's always going to be 1, 2, 3 process. And for the injectors, it's usually going to start with preparing. You want to prepare to come into this industry with the right foundation, the right knowledge, the right historical references with the right foundation so that you can build on that. It's like everybody always uses the analogy about building a house. If you don't build a strong foundation, it doesn't matter how pretty the top of it is, you don't have a good foundation for it to rest on. With employers, we look at that first starting point in hiring someone to screen them, make sure they are somebody who is going to fit your culture, who is going to fit into your practice, who's going to be a team player, and really see, is that person that so many times in this industry, especially, we make judgments on what somebody looks like on the outside. And the screening really gives a prospective employer insight into who is this person as a potential employee and teammate. And so we really encourage people to start right at that foundation, whether they are a new injector or an employer looking for a new injector, and really understand that foundation of what you need to know and who that person is. The coaching part comes in the middle, the training part comes in the middle, whether we're looking at for injectors or for employers. Titan really does provide a great network of training from that preparation program. The Titan Injector Preparation Program is a 2-part program that starts with learning the industry and the history of the industry, and then also learning the facial anatomy. We partner with the Complete Face team. Dr. Stephen Liu and Peter Callan created the most amazing app that you can find on www.completeface.net. It is an incredibly cost-effective online cadaver anatomy encyclopedia almost that focuses specifically on the face for aesthetic procedures. And then once they've learned that foundation, they go on and we do the second course, which is called Teaching Your Brain to Inject. And when I first started Titan, we had all these people who would go to training and then come back and say, okay, I'm certified in fillers and toxins, and I've sent my resume to every place in town and nobody will hire me. Can you help me? And well, first of all, if you sent your resume to every place in town as a recruiter or a support person, I can't help you because they won't pay me. But so with looking at that, we basically have started, transitioning more over to let us help you really train the right way. And so that's where we look at the Titan course that starts with preparing to be an aesthetic injector and learning your anatomy, and then going on to teaching your brain to inject. Because if you teach your brain to inject before you teach your hands, then you're going to understand that foundation and have those critical thinking skills to be able to understand about each particular patient that's sitting in your chair. Facial aging is the most important part of understanding what happens to anatomy. And when you know what happens to anatomy, then it's very easy to go on and think about, okay, what am I going to use to address the concern that my patient has with the right appropriate treatment? So whether it is a toxin, whether it's a filler, whether it is a energy device, whether it's surgery, those are all different options for patients. And you have to have that knowledge of anatomy and those critical thinking skills to be able to know why you're going to choose the path and not just what are the 5 insertion points for a toxin. So when people are done with that part, whether they are looking to get into the industry or whether they're a new injector working for a practice already, we know that that's their foundation. And now they need to do hands-on injecting. So we have a lot of practices that will hire or basically send their new injectors through the Titan Injector Preparation Program, and then they do the hands-on training within their own practice. Or we have a lot of people that will send them through the Titan Injector Preparation Program and then send them to one of the practices on the Titan network. The hands-on training network that we have with Titan has really been a well-vetted group of trainers. We have 5 very specific criteria of who can be listed on our site. Number 1, all of the sites that are on all of the training organizations that are on our website are owned or directed by non-physician aesthetic injectors. I think it's very important that if someone is going to be an RN, NP, or PA injector, that they really learn and train from someone who does the job they want to do. It just helps them have the perspective of understanding the role of the provider. Secondly, they all are actively practicing injectors. They are not people who just decided to open a training company, so they all still actively inject and understand the patient experience. Third, they all have websites and training curriculum where you can go and you can fully investigate what you're going to be learning and what the objectives are. Fourth, they all are trainers for one of the national companies or training organizations. So you know that person is a well-trained and a credentialed trainer. And fourth, if they do have, or fifth, if they have a training faculty, we do ask that that training faculty be listed on the website. We don't want somebody, you don't want to just go to a town and sign up for, oh, I'm going to do this training and then figure out who the trainer that's going to be teaching you is the day you get there. So we really try very, very hard to provide a very strong list of credentialed trainers that are not only going to give you good training, but that are going to follow up and be mentors available afterwards.
Yeah, that's awesome.
Then the coaching comes in. Yeah. So then we do a lot of coaching and consulting. So we really are kind of going away from doing more actual recruiting. We have a wonderful partner named Job Snob, and they do a lot of recruiting for injectors as well as for front office managers and things like that. But we really want to be the centralized focusing area for people coming into the industry for education and knowledge and networking. And so we will work with all of the titans that go through our training program to coach them and prepare them. We teach people how to do resumes. I mean, the aesthetic resume is very different than the resume for, applying for, an office manager or something like that. So we really coach people on how to put that aesthetic training first. We coach them on how to interview. We coach them on how to send their information. We coach them on how to find potential jobs. We coach them on how to follow up after the interview. We will help and negotiate with looking at contracts and job offers and going through so they really understand, what they're getting into with getting this new position. So, sports agents and Hollywood agents, those people are all out there helping their clients. And that's a little bit of what we do with Titan. We take these new injectors under our wing and we help them have a coach or a guide to help them enter this industry. But the employers love it when we do that because they end up with people who really have good expectations of what they're getting into, who understand that you're going to have to work very hard to build a career in this industry. You're not going to come in and make $150,000 right away. You're going to start at the bottom and you're going to have to build, a patient base. I joke with my clients all the time. Look, until you're bringing revenue in, there's no revenue to pay you. You're not going to start with $150,000 a year working 4 days and no nights and weekends and 4 weeks of vacation. You're going to work nights. You're going to work
But
weekends.
There is that upside, like we discussed. That obviously, it's just like you said, you've got to build that book of business. And
that's another thing. I think it's really important that these are medical patients. These are not guests. These are not, they are patients. You have to still have them fill out HIPAA paperwork. You still can get, malpractice. So, these are practices. These are not stores. These are not boutiques. These are practices. These are medical clinics. And these are patients. And I think that's something very important for everybody to realize. We're not getting manicures and pedicures here.
Yeah, absolutely. So I guess to wrap things up on that front, if you had one kind of final thought, and I know it's hard to pick because it's really, most things come down to a combination of factors. But if you had to narrow it down to the number one thing on the list that successful practices do well when it comes to hiring, staffing, and keeping injectors and employees, what would that be? That's
super easy. It's communication. Okay. It is literally having regular communication, whether it be about objectives, whether it be about your goals and your mission for the practice, whether it be about finances. I mean, practice owners laugh at me all the time, but I say, sit down every single month. You don't have to give them the dollars, but give them the percentages, because every injector that I know that wants to leave to start their own business wants to do it because they think they control the patient experience. They think they control the patient products used, and they think they can control the money. And they have absolutely no idea how thin the margins are in aesthetics. And if practice owners will communicate, here's where we are. Here's 100% of the pie. Here's how much is left. I think most employees in practices would be shocked at how difficult it is to run a medical aesthetic practice. And so when we're looking at that, communication is absolutely the strongest. What do you need them to do to achieve the goals for the business? Make sure they know what the goals for the business are, and make sure they know what the revenue needs to be in order to keep everybody happy. And that's why, when you can have a profit sharing or something where they're tied into that success, you really can have everybody work together as a team, working toward common goals, and always, always, always keeping the patient at the top of the priority list for whatever you do in the practice. These are medical practices and patients, and we need to make sure patients always come first.
Absolutely. Well, thank you so much, Mary Beth. Where can people find out more about you and Titan Aesthetic Recruiting?
We're on Facebook at Titan Aesthetic Recruiting. We're on Instagram at Titan Aesthetic Recruiting, and we are at www.titanesthetic.com.
Awesome. Thank you so much. I appreciate it. And we'll see you next
Thanks
time
for
on the
having me,
podcast.
Ricky. Sure appreciate it.
Thanks everyone for tuning in. This podcast is a production of MedSpa Magic Marketing. If your med spa or aesthetic practice is in need of digital marketing services, help with advertising on Facebook, Instagram, Google, lead generation, and booking more appointments, please visit medspamagicmarketing.com.